Good morning. This is Dr. McDaniel. It is Wednesday, happy hump day, and it is May 15th, 2019. Thank you for joining me today. And today I thought I would speak a bit on prenatal vitamins because I get quite a lot of patients who come into the office and they're either thinking of becoming pregnant or they are already pregnant and they want to know what to do about taking supplements, vitamins, what kind of diet, things like that to take. So I'm going to do a few sessions this week and potentially through the weekend about pregnancy, prenatal preparation, supplementation, etc. So today I'll speak on prenatal vitamins. Prenatal vitamins are multivitamins that have a little bit of extra supplementation. The extra that prenatal vitamins usually or should have is calcium and vitamin D for bone health, bone support, bone production development. In addition to that, a lot of them will have iron supplementation, and that's because all women during pregnancy will slowly but surely become at least mildly iron deficient, and that's due to the increased blood volume that occurs during pregnancy. It's called a dilutional anemia. So everyone becomes a little bit iron deficient, so most prenatal vitamins will have iron. All of them should have folic acid, which is a B vitamin, and folic acid is important to decrease the risk of neural tube defects like spina bifida, so problems with the spinal cord of the developing baby, specifically the lower spinal cord and spina bifida, can become improperly or suboptimally or only partially developed. So there isn't a spinal cord in the lower half, it's just skin barely covering that area. And subsequent neurologic problems with the legs, lower extremities because of that. So calcium, vitamin D, iron is most common. Folic acid, which is folate or B vitamin. In addition to that, most prenatal vitamins will also have DHA, which is hexanoic acid. That's an omega-3 essential fatty acid. And essential fatty acids, as the name implies, they're essential to our well-being and health. They're fatty acids, so they help the maturation, the development, and maturation and development of neural development, and also for to help with cholesterol, for liver function and brain function and neurologic function. I think those are all of them. Yes, those are all of them. So they're multivitamins that should have extra supplementation in those areas: DHA, calcium, vitamin D, oftentimes iron, and folate or folic acid. Now, all prenatal vitamins should have the minerals and supplements to help round out our diet that are in the regular multivitamins. And not all of them have iron because most women will have some degree of constipation or bloating issues with iron supplementation. So a lot of them don't carry iron, and they allow the woman, as the pregnancy goes along and as she starts to develop issues potentially with anemia or symptoms for anemia, as she's monitored, then the iron supplementation can be added. A lot of women start off the pregnancy not fully at a normal level for iron because they may have heavy cycles or long cycles, so a lot of the prenatal vitamins will just automatically have the iron included. If someone needs iron supplement and they take it with their prenatal vitamin, they can overcome the constipation, bloating issues that will most often develop by just increasing their fluid water intake, adding prunes or fruit with the skin on it to increase fiber, and or just adding fiber as a supplement. So Metamucil is a common one, or Dulcolax is another common one. And psyllium seeds are frequently added to the diet or used. That's psyllium, P-S-Y-L-L-I-U-M, in order to add to the diet to overcome potential bloating, constipation issues. Sorry. One can get all of those supplements through the diet. So a lot of research has been done on the necessity or the importance of prenatal vitamins for women before and or during pregnancy, and the research says that most women don't need prenatal vitamins. They get the vitamins and their body just eliminates them through their urine because it's not necessary. But on the other hand, a lot of women don't have the capacity or the desire to increase their diet appropriately, or the knowledge to increase their diet appropriately in order to get all of those recommended minerals, vitamins, and supplements in their diet. So the prenatal vitamins will help round out those areas where they're missing. I like to tell my patients a lot when they ask, is it important or is it necessary, or do they have to take prenatal vitamins? I always tell them, I'm sure Einstein's mother did not take prenatal vitamins and she still had a genius. So it's not going to be a deal breaker, but it will only help. And nowadays where they're saying that we have a lot of pollution, so that causes a lot of inflammatory issues. People are getting more sugar in their diet. Sugar is an inflammatory agent. We're eating more breads and refined foods. Those are inflammatory agents. And the soil that we're getting our vegetables and fruits in, it's not as nutritionally sound as it used to be. Even if you get the non-genetically modified fruits and vegetables, it's still, as the research is saying, our foods are not as nutritionally packed as they were just 50, 60 years ago. So prenatal vitamins will help, they'll never hurt. They just may not be completely necessary for every individual. So you have to look at your diet, assess what you're getting, and then decide if it's important for you to take vitamins. Now, as I always tell the patients, if the vitamins are making you sick to your stomach, then you don't need to fall on the sword for them. Try to source out food items that you can add in order to round out the areas that you need in your diet. Tomorrow, I'll talk about different foods that will give you the supplements that are in the prenatal vitamins if you want to avoid taking pills or chewables or tablets. So I hope that's been a helpful introduction on the necessity and the use of prenatal vitamins for women who are contemplating and or already pregnant. Thank you for joining me this morning. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. It's GYN Corner on YouTube. I have all of the live streams that I'm doing here on Facebook labeled and identified on the YouTube channel. And as I always say, please like, subscribe to the channel, and comment. If you'd like to visit here, we're in Manhattan, Midtown Manhattan, New York City. It's Midtown Gynecology. We're on the internet. There is a button on the Facebook page, or you can call the office, make an appointment. I'd love to see people who are watching this channel on the Facebook or on YouTube. Thanks again. Have a great day. Bye.